Hi, welcome to the Nurses Academy. Today we will discuss about some of questions regarding diabetes mellitus. First question, knowing that gluconeogenesis helps to maintain blood glucose level, a nurse should. Here question is, gluconeogenesis helps to maintain blood glucose level. What is gluconeogenesis? A process of transforming non-carbohydrate substance into glucose. For example, lipid, fat is converted into the glucose. Gluconeogenesis means transforming of non-carbohydrate substance into glucose is called gluconeogenesis. So, how nurse understand this process? A. Document weight changes because of fatty acids metabolization. Evaluate the patient sensitivity to low room temperatures because of decreased adipose tissue insulation. Protect that patient from sources of infection because of decreased cellular protein deposits. D. All the above. So these are all correct only. Document of weight changes because of fatty acid metabolization. So gluconeogenesis means process of glucose from the non-carbohydrate substance. So here fatty acids are the non-carbohydrates. So we have to see the weight changes in patient. Second one, evaluate the patient sensitivity to low room temperature because of decreased adipose tissue insulation. And 3, C is protect the patient from source of infection because decreased cellular protein deposits. These 3 are correct. D is all the above. Next question. The nurse is admitting a patient diagnosed with type 2 diabetes mellitus. The nurse should expect that following symptoms during an assessment except. So type 2 diabetes mellitus patient admitted in the ward. Ward nurse expect symptoms during assessment except A. Hypoglycemia, B. Frequent bruising, C. Ketonuria, D. Dry mouth. So frequent bruising will be there. Ketonuria means ketone bodies in urine present in type 2 diabetes mellitus. Dry mouth also is there, but hypoglycemia is not present with the type 2 diabetes mellitus. Hyperglycemia is present in the patient with type 2 diabetes mellitus. Next, glycosylated hemoglobin means HbA1c. Hemoglobin is containing glycosylated hemoglobin. Test measure the average blood glucose control of an individual over the previous 3 months. Which of the following values is considered a diagnosis of a pre-diabetes? The normal value is, the normal HbA1c is 6%. Up to 6% it is called normal. Okay. If pre-diabetes, here they are asking pre-diabetes patient, how we will diagnose? A. 6.5 to 7%, B. 5.7 to 6.4%, C. 5.5% to 6%, D. less than 5.6%. So pre-diabetes condition, B is our answer. 5.7 to 6.4% in between the patient value will be there, means he is having pre-diabetes. The HbA1c will measure for 3 months average glucose in blood. Next question. Rotation sites of insulin injection should be separated from one another by 2.5 inches and should be used only every A. third day, B. every other day, C. 1 to 2 weeks, D. 2 to 4 weeks. The answer is C. 1 to 2 weeks. How? 1 to 2 weeks. So the rotation sites of insulin for injection should be done every week or 2 weeks. Frequently using the same spot over a time can cause fat cells to break down, build up lipodystrophy, causing lumps under the skin, maybe interfere the insulin absorption. See, long time, this is, we are using, think this is abdomen, we will use, so Here we have used means 1 to 2 inches, then 1 to 2 inches, 1 to 2 inches, 1 to 2 inches. Here we have to see the rotation of the insulin site. So this is first day we had given, second day, third day, fourth day, fifth day, sixth day, seventh day. Again after 1 week, after 2 weeks only we have to give same area, because here fat tissues, what will happen, lipid dystrophy will happen. So breakdown of here lipids will be breakdown. Again we will give here same site, there is a forming of the lumps under the skin, lumps. If lumps will form, then insulin absorption will decrease. So we need to rotate the site of giving injection every 1 to 2 weeks. Next question. A clinical features distinguishes hypoglycemia reaction from a ketoacidosis reaction is A. Blood vision, B. Diaphoresis, C. Nausea, D. Weakness. B. Diaphoresis. What is meaning of diaphoresis? So diaphoresis, a hypoglycemic reaction activates a flight response in the body, which then triggers the release of epinephrine and non-epinephrine, resulting diaphoresis. Low blood sugar level can affective activity of autoimmune nervous system, which is responsible for the reaction that people cannot control, such as sweating, digestion. The cholinergic system is the part of ANS. ANS means autonomic nervous system, and it regulates the production of sweat and other secretions. Activation of this system can lead to sweating. So here diaphoresis means sweating, over sweating. So hypoglycemia condition, the patient will get sweating. If patient is having ketoacidosis, there is a trigger the epinephrine. So this also can causes diaphoresis, and also activates low glucose level, causes ANS means autonomic nervous system activation. It is also responsible for the sweating, increasing sweating and digestion. So if there is a low hypoglycemia means decreased glucose level in blood. Decreased glucose level in the blood is called hypoglycemia. If hypoglycemia will happen, epinephrine will trigger, then increase sweating. If low sugar also will causes the stimulation of the autonomic nervous system, it is also causes the sweating and digestion increased. So a clinical feature that distinguishes a hypoglycemic reaction from a ketoacidosis reaction is first option is diaphoresis. Next question. A clinical nurse assessing a patient with microangiopathy who has manifested impaired peripheral or atrial circulation includes all of the following except A. Integumentary inspection for the presence of brown spots on lower extremities, observation for painless of the extremities, observation for the blanching of the feet after a leg are evaluated for a 60 seconds, palpation for increasing pulse volume in the arteries of the lower extremities. So D is our answer. So a clinical assessment, microangiopathy we are seeing. So who has manifested impaired peripheral atrial blood circulation. So what we need to see, peripheral blood circulation is not there, means extremities or upper extremities, lower extremities, there is no blood circulation. So what nurse we will see. So we have to observe all these things except this. So A. Integumentary inspection should be done. Any brown spots is there in lower extremities, we have to do. And observation for painless of the lower extremity, we have to see. Any pain is not there, like that. Because diabetic neuropathy, we have to see here. Observation of blanching of the feet after the legs are elevated for 60 seconds. We have to elevate the legs, then only we have to see any blanching is present in feet, like that. These all three things as a notes we have to see. But D, palpation for increased pulse volume in the arteries of the lower extremities, because increase pulse volume. How? There is no blood circulation in lower extremities. How we will increase pulse volume? Okay, so this is incorrect. The answer is palpation of increasing pulse volume in the arteries of the lower extremities. Next question. The nurse expects that a type 1 diabetes may receive how much of his or her morning dose of insulin postoperatively. The nurse expects type 1 diabetes may receive how much his or her morning dose insulin postoperatively. So patient undergone for postoperative surgery. So preoperatively, sorry. Here the patient before surgery, how much insulin we have to give? 10 to 20%, 25% to 40%, say 50 to 60%, and 85 to 90%. Here the answer is C. So preoperative day we need to give regular dose we need to give only 50 to 60% before surgery. Next question. Albert, a 35 years old insulin dependent diabetes, is admitted to hospital with a diagnosis of pneumonia. He has been febrile since admission. His daily insulin requirement 24 units of NPH. Every morning Albert is giving NPH insulin. 7:30 meals are served at 8:30 and 12:30 and 18:30. The nurse expected that NPH insulin will reach its maximum peak between the hours between the hours 11:30 to 13:30 means 1:30, 1:30 to 5:30, and 15 to 21, and 17 to 23. Between what time the insulin will be peak? NPH insulin human. So here the answer is B. 1:30 to 19:30 means between that time it will be more. The peak insulin will be peak. So NPH, human insulin, has an onset of insulin effect 1 to 2 hours, a peak effect 4 to 6 hours, and the duration of action more than 12 hours. Very small doses will have earlier peak effect and shorter duration of the action, while higher doses will have longer time to peak effect and prolonged duration. Here NPH insulin, this insulin is a intermediate acting insulin. NPH insulin is intermediate acting insulin. So the peak level will be always 4 to 6 hours after giving insulin. So when it will be means after 1 hour it will be more. So that we are giving 12:30 now, 24 hours, 24 units. 7:30 meals we had given, like that 12:30 to and 8:30 like that we had given na. So the peak level will be 1:30 to 9:30. The hours peak level action will be 4 to 6 hours. Next question. A male nurse is providing bedtime snacks for his patient. This is based on knowledge that intermediate acting insulin are effective for an approximate duration is intermediate. Already we have discussed 14 to 18 hours it will effective. Next question. A nurse went to patient room to do routine vital signs monitoring and find out that patient bedtime snacks was not eaten. This should alert the nurse to check to assess for A. Elevate serum bicarbonate and decrease blood pH, signs of hypoglycemia earlier than expected, symptoms of hyperglycemia during the peak time that NPH insulin, D. Sugar in the urine. So patient not taken meal na eaten. So B is our answer. Signs of hypoglycemia earlier than expected because the patient not taken snacks. A client is taking NPH insulin daily evening every morning. The nurse instructed that patient that the most likely time for an hypoglycemic reaction to occur is A. 2 to 4 hours after administration, B. 16 to 14 hours after administration, C. 16 to 18 hours after administration, D. 18 to 24 hours after administration, B. 6 to 14 hours after administration is our answer. An external insulin pump is prescribed for patient with DM. The client asks that nurse about the functioning of the pump. The nurse bases the responses on the information that the pump Here, A gives a small continuous doses of regular insulin subcutaneously that the client can self-administer a bolus with an additional doses from the pump before each meal. B. It is time released programmed doses of a regular or NPH insulin into the bloodstream at specific intervals. C. It is surgically attached to the pancreas and infuses regular insulin into the pancreas, which turn release insulin into the bloodstream. D. It is continuously infuses small amount of NPH insulin into the bloodstream while regularly monitoring a blood glucose levels. So the answer is A. So this blood pump to the insulin pump give a small continuous doses of regular insulin subcutaneously. The client also self-administered the bolus with the additional doses from the pump before each meal. A is our answer. A is answer. 13th question. Next question. A client with the diagnosis of diabetic ketoacidosis DKA is being treated with in the ER. Which finding would a nurse expect to note as a confirming this diagnosis? So, what finding we can confirm he is having DKA? A. Elevate blood glucose level and low plasma bicarbonates. B. Decrease urine output. C. Increase respiration and increase pH. D. Comatose. So, the answer is elevate blood glucose level and low plasma bicarbonates. So, hypoglycemia earlier than expected. A signs of hypoglycemia earlier than expected. Eating a bedtime snacks can prevent the hypoglycemia. So, here the answer is elevate blood glucose level. At the same time, there is a bicarbonates also low in bicarbonates. That is the sign of diabetic ketoacidosis. Next question. A client DM with DM demonstrate acute anxiety when first admitted for the treatment of hyperglycemia. The most appropriate intervention to decrease the client anxiety would be patient admitted, diabetes patient admitted in the hospital and treatment of hyperglycemia. He is having hyperglycemia, at the same time he is also having anxiety. So what intervention we will take? The patient is having anxiety. A. Administer a sedative. B. Make sure that the client knows all correct medical terms to understand what is happening and ignore the signs and symptoms of anxiety so that they will be soon disappear. Convey empathy, trust, respect towards the client. So this answer, what nurse should do? Convey empathy, trust and respect towards the client. This is our answer. We have to show some empathy towards the patient and we have to trust patient because he is having anxiety and respect towards him, and we also show the respect towards the patient, then the patient will be recover from the anxiety. Next question. A nurse is preparing a plan of care for a client with diabetes mellitus who is hyperglycemia. The priority nursing diagnosis would be the patient is having diabetes mellitus. Who has hyperglycemia? What is main priority diagnosis of nursing diagnosis for this patient? High risk for deficient fluid volume. B. Knowledge deficit decreased process and treatment. Imbalanced nutrition less than the body requirement. D. Disabled family coping impairment. So here high risk for deficit fluid volume is our main priority diagnosis for this patient, because the ketoacidosis hyperglycemia patient, they will frequently go for the urination. There is a fluid volume deficit will present this patient. Next question. A nurse is caring for a client admitted to the ER with DKA. In the acute phase, the priority nursing action is to prepare to admitted to the ER with DKA. In the acute phase, the priority nursing action is to prepare. Administer regular insulin intravenously. Administer 5% dextrose intravenously. Correct the acidosis. Apply an electrocardiogram monitor. So only regular insulin we have to intravenously we have to administer. Patient came with the DKA and hyperglycemia. Next question. A nurse is performing a physical assessment on a client with the type 2 diabetes. Findings including fasting blood glucose of the 120 mg per dl, temperature 101 degrees of Fahrenheit, pulse is 88 bpm, respiration 22 bpm and BP is 140 by 84 mmHg, which finding would be the most concerned the nurse? A. Pulse, B. Blood pressure, C. Respiration, D. Temperature. D. Temperature. And pulse, blood glucose is 120 mg per dl, near normal, and temperature is more, 101 degrees of Fahrenheit. Pulse is 88, normal. Respiration also normal. BP also near normal. So then as a nurse we have to take care of the hyperthermia, 101 degrees of temperature. So we will give priority to reduce the temperature. Next question. A client with type 1 diabetes mellitus calls the nurse to report recurrent episodes of the hypoglycemia with exercise. While doing exercise, hypoglycemia state we can see in the patient. Which statement by client indicate an inadequate understanding of peak action by NPH, insulin and exercise? A. The bedtime for me, exercise is every afternoon. The best time for me to exercise is right after I ate. The best time for me exercises after best breakfast. The best time for me to exercise is after my morning snacks. So the best time for me exercises every afternoon is patient is talking, patient is not having knowledge regarding NPH insulin. So me exercises right after I ate. Okay, it is correct only. The best time for me exercises after breakfast. The best time for me exercises after the meal. So understanding the inadequate understanding is the afternoon time. So A is our option. A client with diabetes mellitus visits a health care clinic. The client diabetes previously had been well controlled with glyburide diabeta tablet 5 mg PO orally, but recently the fasting blood glucose has been running 180 to 200 mg per dl. Which medication, if added to the client's regimen, may have contributed to hyperglycemia? A. Prednisolone, B. Atenolol, C. Phenelgin, D. Allopurinol. So A is answer prednisolone, control hyperglycemia by prednisolone. Next question. Glucose is an most important molecule in a cell because this molecule is primarily used for extraction of energy, B. Synthesis of protein, building of generic material, D. Formation of cell membrane. Answer is extraction of energy. Thank you for listening. This is our small topic regarding sugar diabetes mellitus. Thank you. If you like this video, please like, share and subscribe. Thank you.